Hi, my name is Denise Cruz. I am a speech-language pathologist. I am the director for clinical education and clinical services here at the Ruth Smadbeck Communication and Learning Center at Marymount Manhattan College. This is a little hidden gem on Manhattan's Upper East Side. We are fortunate to be able to extend our services to the community and provide speech-language services to children all the way through geriatrics. Our student clinicians enjoy a one-to-one student to clinical supervisor ratio, and we guide them through the clinical process in diagnostics as well as therapy. So today I'm going to take you on a little tour of our speech clinic. The first room I'm going to show you is our group therapy room. And this is the room where many things happen. This is where we hold our adult group therapy sessions. For some of our smaller, more intimate classes, for example, our clinical methods course or any courses that are 10 students and below, if we have more of a brainstorming session or if we have presentations to do, this small intimate setting really allows for a lot of collaboration and exchanges of ideas and troubleshooting. So right now we are in our pediatric room. This is a room where our students would generally treat children anywhere from 1 to 6 years of age or even 7. We have lots of age-appropriate toys here to really use during our therapy sessions, everything from cards to manipulatives. And our students, as a student clinician, this is the closet where they get to troubleshoot and think of what will they use in therapy with the children. And as a pediatric patient that comes here, this is one of their favorite places. It's also known as the reward closet. So right now we are in one of our adult treatment session rooms. This is where we would conduct therapy sessions on a one-to-one basis or adolescent therapy. Again, just like we have our pediatric closet, we have our adult cognitive closet, and this is where we have many of our cognitive games that we are generally used in therapy. As you can see, students that come to Marymount have a lot of materials that they can work with and be able to be creative during therapy. Our clinic has a lot of technology, so in these two-way mirrors we have recording systems that record the student clinicians as they're doing their therapy. As a result, students are then able to sit back, review their sessions and reflect on what they did in therapy along with their clinical supervisor and plan for the following session. They're also able to troubleshoot as a result. They can review their sessions and see what worked, what didn't work, without having to have a supervisor come in and tell them in front of their patient. We are currently in our Communication Sciences and Disorders Research Lab. One of the great perks of being a Marymount Manhattan student in speech pathology is that we do have a designated research space, and students here that want to conduct research have the ability to work along with a professor in their research of choice. And this is the room where they can come, lay out ideas, get their research technique, and hopefully present at a national conference. These are our audiology booths, which are used for our audiology courses. This side of the booth is also full of technology, which we do use when it's not in use for audiology. It's an additional study space for the students, as you can see. And it's a nice quiet space. Our students do get hands-on audiology and hearing screening experiences here at this clinic. And this is the other side of the audiology booth. This is where the audiometer would go and the patients would be on the other side of the booth. When it's not in use, again, it's an additional space that we use for additional quiet study time for our students. We like to think of the clinic as the bow in the package. The clinical experience is what ties everything together. So you now have spent your 3 years taking all this theoretical coursework, and in many different cases what happens is you don't get to apply it or even start tying the bow until you are in graduate school. And what's unique about us is that you take your theoretical coursework, then you come to clinic and you tie your bow. It makes it all come together. I think what's a very common thought, a comment from our students is that everything clicks when you get to clinic because you're applying everything that you just spent 3 years covering.